because so we will start. I just wanted to welcome everyone to our 4th installment of Michigan Communities Conquering COVID. We want to thank everyone for joining us tonight. We know that you, the audience, and our esteemed panelists are busier than ever. So we appreciate the time you have given us tonight, and we hope we'll be able to answer all of your questions. Before we get started, we want to remind everyone that this event has closed captions. Oh, and I need to start those. Actually, Amy, if you could hit closed captions on the bottom, as well as live Spanish interpretation. For English speakers, make sure you click the globe at the bottom and choose English. I'll ask Dr. Militzer to repeat the message in Spanish on the English channel. Thank you. My name is Tricia Bachowski, and I'll be your moderator for tonight. I'm the Administrative Program Director for Community Engagement within the Michigan Institute for Clinical and Health Research. We are part of the Medical School's Office of Research at the University of Michigan. Community engagement works to engage both community and academic partners in equitable research partnerships that does meaningful work. In the fall, our faculty director, Dr. Erica Marsh, was funded alongside Dr. Barbara Israel in a project funded by the National Institutes of Health called The Fierce Urgency of Now, Michigan Communities Conquering COVID, AKA Michigan CEAL. Part of this work has been to host a monthly webinar, which came directly from our community partners. And it was to answer questions about COVID-19 vaccines in a timely manner. Another project I want to mention is a community crowdsourcing campaign called Take the Mic, where we asked community to write creative written word and multimedia messages around COVID-19. I just wanted to let everyone know that voting for finalists is now open at takethemic.org. At this in the chat. And just so you know, it's in English, Spanish, and Arabic. So I'm just going to jump back to the webinar tonight. We are excited for our panelists. We've invited from 3 county health offices, from Kent County, Genesee County, and Wayne counties. I'll introduce each of them now, and I'll ask them to provide opening remarks after I introduce them. So first, we want to welcome Dr. Pamela Hackert from the Genesee County Health Department. Oh, I heard something. Maria, you're on Spanish, right? Okay. I want to welcome from Kent County, Dr. Adam London, who's the Administrative Health Officer at the Kent County Health Department. I want to welcome from Wayne County, Carol Austerberry, who's the Health Officer for Wayne County Health, Human and Veteran Services Department in Wayne, Michigan. I also want to welcome Dr. Sandro Cinti. He has been on each of our monthly webinars for 4 months, and he's our Michigan medicine expert. And just so you know, he's on the Michigan Medicine COVID Vaccine and Therapeutics Task Force and is a professor of infectious disease. So I'll now ask each of our panelists to provide opening remarks. So we're going to go in alpha order so that there's no preferential treatment. We'll start with Dr. Hackert.
Wouldn't that be Austerberry?
The county, alphabetical order of the county. Sorry. We'll
thank
switch
you.
it up.
Thank you for inviting me tonight. So as you mentioned, I am the medical health officer for Genesee County, and that is a new position that they created. I began this position on January 5th, and it's both the medical director and the health officer. One other county in Michigan does that, a smaller county though. And so the goal was to be very agile and to facilitate getting, not only the pandemic response, but many other programs going quickly and using medical evidence for Genesee County. And one of the things that when I got here, we had to start up our whole plan. And I knew we needed more than just goodwill. We actually needed to have this based on medical evidence. So we wanted to use some of the things we already knew. And one of the things we knew is that the first wave of COVID last year hit Genesee County almost identically to what was the hardest hit areas from the water crisis of 5 years ago. So we've been working with MSU on their response, and they have a distress index. So that's where we used our medical evidence to start to be able to decide where we were going to stand up our first vaccine clinics in the county was based on the distress index. And we have been moving almost every week, changing something in response to it using data-driven methods.
Thank you. Dr. London?
Thank you, Tricia, and good evening, everyone. It's been a long year. It's been a long year for everyone, and just very excited for this conversation this evening, and very excited to be joined by my colleagues and by all of you this evening. Over the course of the past year, we have been faced with a tremendous number of challenges, and I think the challenges that we have been faced with have really underscored the importance of public health and the importance of the social determinants of health and the importance of public health being bigger than just the local health department, but really being about community and all the organizations in that community. And so it has been exciting and encouraging over the course of the past year to see all of these different organizations in the community come together in such an outstanding way. When we first heard about coronavirus reaching our shores, and we knew that it was going to be a matter of time before it was everywhere, their response from people in public health, that they took it personally, that we knew there was nothing we could do to stop it from coming, but there was an awful lot that we could do to stop it from being as severe as it could have been. And so I'm very proud of all that we've done in public health, and I'm very proud of all of you who have done your part in the community to make it difficult for this virus to spread. And while the impact has been way too catastrophic, it's been a lot less than it could have been. And we've learned a lot of important lessons from this, hopefully lessons that we can use in the future as well. So again, thank you for inviting me this evening, and look forward to our conversation.
Thank you. And Carol, you want to add your comments?
Yes, and again, thank you so much for having me this evening. And as Tricia said, I'm Carol Austerberry. I'm the health officer for the Wayne County Health Department, the largest health department in the state. And we have just a challenge of when you think about how many people in our jurisdiction, over 1.2 million people. And the communities here in Wayne County are so, they're geographically spread out. And then, just the diversity for you know, economically and socially and culturally. And so our plan and our response is a county-wide response, but yet has to be very tailored for the different, you know, parameters for each of those communities. A lot of how we have really approached this, from our testing sites to now our vaccine sites to our field clinics, we've split the county into like 4 quadrants. And within each one of those quadrants, then we really look at the communities in those quadrants and using those social vulnerability index rankings and identifying, you know, where those needs are and what is going to be the unique or the specific way that we can get the engagement from the community, from the residents. Because as you know, both Pam and Adam have said, I mean, it's been public health, but we're working with our members in our community. We're working with our healthcare systems. We're working with our faith-based system, you know, faith-based partners to all work together, because you know, this is a community, you know, pandemic, and it takes the leadership of your public health department and many other community leaders to, you know, fight it and, you know, win against this. So with that, I'm excited to be here tonight, excited to, you know, hear the feedback from, you know, everyone here, and just, you know, always working together has really been from the very first, you know, time when, you know, that first case hit Wayne, you know, our big driving force. We're all here as a team, you know, working together. Thank you.
Thank you for that. Before we move on to the questions, I just wanted to welcome to the floor Dr. Cinti, who's been here every month. Did you have any welcoming remarks or opening comments you wanted to make before we jumped into questions?
Well, let's get to the questions soon. I just want to thank everybody here for being here. I agree. This is an effort that has to be a combined effort between the hospital systems, the political system in the state, and public health. And public health has been great in this state, and our governor has worked very hard to keep the cases down. And we are having a surge right now. Everybody knows that, and the hospitals are pretty full. But you know what? None of those people are over the age of 65, and that's because what I was going to say Dr. Whitmer, Governor Whitmer has kept our state safe for this amount of time to get those people vaccinated. So we're struggling right now, but I think we're going to get back on track. And part of what I want to do here is make sure that everybody can ask questions about vaccine, because we need to get everybody vaccinated. So I'm ready to go to questions.
You're ready. Okay. So
Yeah.
One of our attendees beforehand, and I think they're here tonight too, they were wondering, what is their risk of breakthrough infection after being fully vaccinated with the Pfizer vaccine?
That's a great question. And everybody's been thinking about this, and the CDC has too. And what's coming out is that it's what you're looking at is you're saying, what's my chance of getting infected and getting asymptomatic or symptomatic disease? It's very low. So the efficacy of these vaccines, as we know, is 95% for Pfizer, 95% for Moderna. And once you're vaccinated, your risk of having asymptomatic disease, which means you could spread it to other people or get sick, is very low. Now, remember, when you're looking at the news, so imagine that there were 1,000 people that would have gotten COVID if they didn't get vaccinated, but all those 1,000 people got vaccinated. There's still going to be 5% of those 1,000 people. So there'll be 50 of those people who'll still get infected. Now, the good news is that even if you get infected, the disease is mild, and almost no people die after they've been vaccinated. Some will, over millions and millions of people, but it works, and it works to prevent from you getting sick and spreading it. Pfizer and Moderna, by the way, not just Pfizer.
They also asked, so if they're fully vaccinated, they've had both the doses of the vaccine, and they're wearing a KN95 mask when they're indoors, do you know their risk then?
If they've been vaccinated, is that what you're saying, Tricia? It's pretty darn low, almost zero. And I would say, you know, the CDC is thinking about this now, and probably within the next month or so, there will be situations where you don't have to wear masks once you're vaccinated. That's where we want to get to. And remember, even if you could get infected, you would get mild illness compared to not being vaccinated. So wearing a mask and being vaccinated is very, very, very safe. Not being vaccinated and not wearing a mask is probably very safe. So I'll stop. And I would take comments, I mean, and input from all the other health, the health officers here, because I'd like to hear what you guys have to say about that too.
Yeah, we can open it up to them, to their response.
Yeah, we can open it up to them, to their response.
Yeah, this is Carol. Yes, I mean, I echo that, and we have done, even from that first question, we've looked at statistics in Wayne County, and less than 1% have we found as far as the, you know, the breakthrough or getting infected after being vaccinated. Again, like you said, very, very low. We, you know, get vaccinated, continue the good mitigation, you know, measures, hand washing, you know, wearing your mask, but we are, you know, it's that whole thing, get vaccinated.
Yeah, and this is Adam from Kent County. And I agree with what Dr. Cinti said. In fact, in our hospitals in Grand Rapids, the people who are hospitalized, as he said, they're not in that 65 and older group by and large. They're a younger group. And we're seeing in general that the 65 and older population, much fewer cases. They're not driving the resurgence in cases right now. And we're also, unfortunately, we're hearing this myth perpetuated by some people that point to individuals who were vaccinated, who subsequently became ill, as some kind of evidence that vaccine doesn't work. Well, that's just not the case. So while you can find individuals, you can find small numbers of people who were fully vaccinated, who the virus broke through and they became infected. It's very rare. When we have vaccinated millions of Michiganders, you are going to find a few where vaccine breakthrough happens. Vaccines are very, very effective risk reduction. They're not a perfect force field around a person, but they are extremely good risk reduction.
Yeah, and another point to make on that is Adam was saying that patients in the hospital are younger. They're also unvaccinated. So there aren't patients. I haven't seen one patient. I was recently on for 2 weeks, and we have 100 patients in the hospital. None of them are vaccinated. So those patients who are vaccinated are protected.
Any other comments? Oh, Dr. Hackert.
I did put in the chat a very interesting link, and while it may look like it's an article, it's really more of a little bit of an example to go through. You just page through it, and it really shows the benefit of wearing masks and the benefit, particularly though, of ventilation, as well as time. Time is really a critical thing.
Thank you. Another question we received is, how are each of you collaborating with people and agencies at all levels to distribute vaccine in the most equitable way? So I'll actually ask Carol to answer that first.
Yes, thank you. So as I said, we really are starting with the social vulnerability index. All of the communities in Wayne County are ranked. And then we went further in splitting up the county into 4 geographic regions. And we really employed this first with our school districts. And it worked out so well that this has been the model for us. So then each region, the communities then based on their social vulnerability index, then those are the first communities that have been, and then the school districts even, where their staff were offered them the vaccine. And so we just continue with the highest ranking communities with the highest ranking SVI down to the lowest. And we then employed that with going out into our communities for our seniors and into clinics. And it's just, like I say, it's worked so well for us in all of our clinics. And then we also use that same 4-quadrant methodology for where we're placing our vaccine clinics. Again, based on the communities that those clinics will serve, the SVI, the population. And so and also with all of this it's a multi-prong approach. Not one, just not one method gets people vaccinated, is my point. And so we've really been working, like I say, in the community, mass, big clinic settings, small clinic settings, clinics on the weekends, clinics at different hours, all of that to make it as convenient and easy for residents to get vaccinated.
Thank you. Next, I'll go to Dr. Hackert.
So we took a little bit different approach, but I think we had the same type of outcome. We worked early on with our community partners because we did already have the benefit of knowing the social vulnerability index, which really correlated to the Flint Water Distress Index. And I didn't want to come in as a new person and presume to know what or where things should be located. So I engaged with our communities really early and had just an amazing response. So since February 10th, I think we had our first faith-based church vaccine clinic, and we have been operating 3 different ones a week in different areas of the community. On top of that, and that was partially so we could have word of mouth spreading. People could come in somewhere where they were comfortable, they could make their appointment with pastors, and we were doing like 400 to 600 a day in each of these 3 different clinics. But we also were trying to move vaccine along as fast as possible, and so we set up a clinic at Northwestern High School, which is in Flint, but is currently closed. That and Bishop Airport have been our drive-through clinics, and that was for the more mobility, people who had mobility. We just last week finally got our MTA associated collaboration. So when people go to schedule one, they can also say they need transportation help and can set up an appointment to have someone bring them through on their like the Rides to Wellness kind of program. But really, I've been taking my cues from the community, and they have been just amazing partners. I can't say enough about how well that has worked, and I've learned so much.
Adam, what's worked for you in Kent County?
So, I wish we would have had vaccine available to us in March of 2020. But one of the silver linings in not having vaccine until December of last year was that we had 9 months to really and genuinely converse with the community about this challenge. And I'll admit, early on, when I saw that there was a disparity in COVID incidents and outcomes, my gut reaction was, once vaccine becomes available, we need to do everything we can to push it into the zip codes and the neighborhoods that are being most severely impacted by this. And thankfully, because of the relationships we had with people in those communities, they were able to say, we appreciate that, but tap the brakes on that. Because if you do that without building trust first, these are communities that have been traumatized historically and abused historically. And when we have a new vaccine, if you roll into those communities without building that trust, it's going to be seen as though we are using the community as guinea pigs to test a new product. So thankfully, we had the time to have those conversations and to learn and genuinely learn from the community about what was helpful and what wasn't, and to invite them in, so that it wasn't my plan that I was pushing out to the community. It was our plan that was coming forward to me. That was very, very important for us. Since then, we have built a number of clinics, both in permanent locations and also those that are very temporary, or we've used mobile units. And Dr. Hackert mentioned pastors. That was an important part of what we learned as well, is that faith leaders can be a very important group of allies to getting the message to the community and to building that trust bridge to neighborhoods and to people who might not otherwise trust representatives from the local government who are wearing a county seal, that, just that, we aren't always the people they look to with a trusting eye.
Dr. Cinti, do you want to add to their answers too about what we've been doing at Michigan Medicine and
Sure.
other health systems about, how are we working to distribute vaccines equitably?
Yeah. And the challenge initially was so as a hospital, Michigan Medicine saw our own patients as our mandate. This is who we have to vaccinate. We quickly realized, and the state helped with this because they used the SVI score pretty early on to try and help us to find the most vulnerable populations. And so we had a group that's worked very hard to identify within Washtenaw County. So we're not just taking any of our patients, we're really focusing on those high SVI zip codes and going to those areas and vaccinating first. Again, the education is very important. I went around our hospital and spoke to some groups that were initially a little bit more hesitant. Now, you're not going to convince everybody, but if you don't get out there and try and show that you're working with groups and with these people and with their supervisors, it won't work at all. So getting out there was very important. I think we have to continue to do that. We're doing pretty well, but I think we can do a lot better to get people vaccinated.
So our next question is similar, and you guys might have already answered it, but I think some additional things might come to your mind, is what are you doing at both testing and vaccine sites, testing sites and vaccine clinics to make them accessible to all? So I know you mentioned mobile units, transportation, utilizing faith-based leaders in the community. But if you can just address that accessibility question that we received from the audience, we'll just mix up the order a little bit. Adam, if you could speak to that first.
Yeah, also, maybe one more thing that we've done in addition to the mobile units and the other devices is, we have the West Michigan Vaccine Clinic at DAAS Place, which is a very large facility, serves thousands of people most every day. Having language resources on site was a key for us. Another key for us is having volunteers that represent the diversity of the community. And that was important to us, so that regardless of who you are, there are people in that facility who speak your language, who can help you navigate that site. And so being very intentional, working with our partners to recruit a diversity of staff and volunteers was very important to us.
Pamela, do you want to answer that?
So we also have been using our community health navigators. And now that our vaccine supply is very generous, we are starting to have them go and try and make appointments in the community. We're using, our biggest struggle, frankly, has been the homebound, trying to get vaccines to them. We've tried multiple different ways and agencies, and with every good intention, people will say, yes, I can do that. Yet the reality is, when they have 100 vaccines, they give it to the 100 people waiting, as opposed to doing 8 a day, in the homes. But we did start that 2 weeks ago, but it really is a challenge. We've also had 2 different sites specifically for the deaf and hard of hearing community. We have worked in different communities where we ensure that there is bilingual translation. One of our sites is Our Lady of Guadalupe, and there's always someone who can address that there. So we are doing multiple different things to try and reach everyone. When I hear of something, I make it happen. But sometimes you just don't know what you don't know.
Yeah, well, and also sharing best practices between counties. I think I have a huge list that I'm just adding to of what you guys are sharing, because, you know, I know Flint and Genesee County has a large deaf and hard of hearing community. So you think of that community, whereas other places might not often do that. So I think that's a great recommendation. Carol, what have you guys been doing in Wayne County?
Yes, well, and actually one of our first sites was right at the health department. It was a drive-through vaccine site. And that worked out. It was very, very good for our first responders, our EMS, you know, we got them through, but then it really segued into a great site for those who had family members who were disabled, or, you know, group homes coming. So they would bring the whole bus or the whole van, or, you know, someone who was, again, just, you know, it was difficult for them to get out, but yeah, if a family member could get them into the car, come to our drive-through site, and, you know, so they just got to stay in the car. Our nurses, you know, went right, you know, right there by the car, and we have followed that model even for our mass vaccine clinics. If someone, you know, calls ahead, okay, I'm bringing, you know, and we've got them all where then they can pull up close. The nurse can go out, administer the vaccine, you know, so that has also, you know, increased that access, especially for those who are disabled. And then we even set up on our website where if you had a family member who was disabled, you could register. And then we, the health department, contacted you directly and set that appointment up for the first and second dose for the vaccine. So that, you know, really helped that group. Same as Adam and Pam have talked about, you know, our homebound. We are partnering also with our local EMS agencies. They are just you know, they know their community, and they, you know, are saying, let's work out so that we know, you know, yes, we've got these, you know, 10 or 12, you know, homebound. We will then, you know, get the vaccine from you, take it, get it into the arms, because they're used to going into the homes, and they know their community, they know their neighborhoods, they know their families. And that's really been working out, again, is kind of a little different approach to the homebound, but, you know, again, in that community partnership and listening to our communities and what, you know, what they need, what, you know, the different agencies and leaders in the community can provide. You know, they're the ones who came to us and said, hey, we've got this idea. And we thought, that's a good idea. Okay, let's go for it. So, you know, like Pam said, you know, when you hear something and you step back for a minute, and that's the joy of all of us for public health, is, you know, working with the community, listening to the community, what are the needs out there, and, you know, and figuring out, you know, what that solution is for us to bring the services.
Thank you. Sandro, did you want to add anything from more of a Michigan medicine systematic kind of level about what we've been doing at the health system to make our sites and clinics accessible?
Yeah, you know, at first we got a lot of vaccine because, as a hospital system, because we were vaccinating our healthcare workers, and then suddenly we had set up this big system, and then vaccines stopped coming. And what we realized is we worked closely with Washtenaw County and Juan Marquez, and that has been a great relationship. We've, you know, once we vaccinated our folks, we worked with the Washtenaw County to vaccinate teachers. They did pop-up clinics for teachers, pop-up clinics for the restaurant staff and grocery staff. And so what we do is we get together on Tuesdays and Fridays with our Washtenaw County folks, and we talk about what are the needs within the community, and then move towards those needs and make sure that we're aligning with the state and making sure that we're getting to the vulnerable areas. And if one of us aren't doing it, we are realigned by the rest of the group. So it works well that way.
Thank you. I'm just asking, Dr. Militzer, you need a break? Okay, we're just gonna pause for one minute if anyone needs to take a comfort break or drink some water. This is where I should have had the music cued. Okay, we'll jump right back in. I think I'll ask you, Dr. Cinti. We had a question in that we received beforehand about if a person received both vaccines but does not develop antibodies. Have you heard that to happen?
It has happened, and it happens with other with other vaccines too, not just COVID vaccines. That's why the CDC says we shouldn't be testing antibody levels. So we as physicians should not be doing that at this point until we get more guidance from the CDC. So really, the two vaccines, if you've gotten two vaccines, you're protected, and you should consider yourself protected and not be seeking to get an antibody test. It won't change that at all. So I think it's better not to get the antibody test, because then I've had physicians call me and saying, oh, I did the antibody tests on these patients. And I said, why did you do the antibody test? They're fine. And we're not giving more doses. So you're not going to get a third or fourth dose of vaccine, and you're not going to get another vaccine. So at the moment, you're protected. And we know it from the studies that the people that got the vaccines, even if they didn't get full antibody protection, even though they didn't get full antibody identification on a test, they were still getting protected.
I guess that you raise one of the other questions that came in too, is are we going to need a booster, or is it going to be like how we get the annual flu shot? Will we be getting an annual COVID-19 vaccine?
Yeah, everybody's considering that and wondering that. And there has been some work on boosters that the pharmacies, for example, Pfizer and Moderna, related to the variants, because the variant from South Africa, the variant from Brazil have a little less efficacy. Now, as I said before, the vaccine still works, but in the future, we may need, if there was one that changed even more, we may need a booster for those changes. We may need a booster if we find that immunity is waning. Having said that, remember, every year we get a flu vaccine, right? And we may be in that realm with coronavirus, but it could be every year, it could be every 2 years, every 5 years. We don't know yet. More information to come on that.
Thank you for that. I know I think we're watching a lot of news sometimes, and then we get too much information. So
absolutely,
it's trying to find that balance of information.
All of us, right?
All of us. The next question comes from someone like-minded to me. They're wondering how community organizations and academic organizations engaged in COVID-19 work can utilize their health departments, social media platforms, and other communication channels to share best practices, events, resources, etc., to help meet the needs of their communities. I'm gonna ask Adam to start us off.
Yeah, it's a great question. I think the first thing they should do is reach out to the health department. They really should have a relationship with that health department. And most health departments, larger ones like the ones that are on this call, have a communications person who's doing that as a full-time job. And they certainly want to share those events and those bits of information that are aligned with our purposes. It's also been very advantageous to us over the past year to have those relationships. We actually built a TV studio in our basement at the Kent County Health Department. And we did that years ago. And we did it because we were tired of having to rely on the traditional media to carry our messaging. And they said we were nuts when we did it, but we did it with something like this in mind, that we wanted to be able to speak directly to the community and to empower partner organizations to do the same. And it so happens that the studio is in the middle of where our clinic is at the health department. And so we've had that opportunity to bring in spokespeople from other organizations as they're getting their vaccine and having them do a testimonial in front of the video camera so that we can then share that on social media. So there's all kinds of ways for organizations to partner with health departments, but it begins that relationship.
I wrote that down. That's some great points. Carol, do you have anything to add about what you recommend from Wayne County's?
Yes, I mean, we are right here in the backyard or the neighborhood with Wayne State University. And as Adam says, we have a long-standing relationship with Wayne State, with their School of Public Health. And when all of this with COVID for the testing and vaccine came about, we actually had money from the state and we put it into an advertising and marketing education campaign. And part of that money, Wayne State, we pulled in, and they conducted surveys, community surveys, and to find out really, again, what was going to be, the questions, the hesitancy around, even, like I say, at that point, it was testing, and then they also surveyed for vaccines. And it gave us such valuable information to then know for all of our communities what was going to really be then that advertising campaign was built on what we learned from the survey. So with Wayne State University, they, as I said, it's a long-standing relationship. We pick up the phone, they pick up the phone, work together, and it's just, they brought that. And then they even did, they really were supportive also with the data analysis and working with our staff about even developing up, spreadsheets where we were able to really crunch the data for the community spread when, schools were going back, and well, what is the community spread based on each individual community. So that like I said, that partnership relationship, it almost doesn't seem like, it almost seems like, Wayne State works for us and we work for them. To me, it's almost tighter than a partnership here. So we always, think of each other and, have built that even stronger with COVID. And I know that's going to continue us, as we get out of this pandemic and then are looking at other programs, public health programs for the community.
Pamela?
So I have to say that this has been going on well before I got here, and I have been so fortunate to come to some, an area where they have had such strong services already being provided by community partners to the community. And one of them has been the Flint Community Webinar. That's been, I think it's either 54 weeks or 55.
57 or 58.
It's high. It's every Friday. It's got quite a following. There's been other events that I've participated on, and they get like 1,000 views. So I am happy to be on them as often as I can. I love the idea of getting the testimonials to post on. So Adam, I'm taking your idea with that. But we have had quite a few just amazing things already in place, but I cannot actually say that I impacted too much of it.
I can recommend to you guys too, if you visit our brand new Facebook page for Michigan CEAL, you can take the recording and share it to your health department's Facebook page. So that's one way to do it. Dr. Cinti, did you want to add anything from Michigan Medicine's perspective about, you know, anything you can recommend when we're working with community organizations or academics and the health department? How do we connect our communication channels better?
It is a challenge. It's a real challenge. Again, I think getting together on a regular basis with these, and again, we're getting together with our county public health, with our other hospitals twice a week. It'll probably, as things get calmer, we won't do it as much, but that has been very helpful. And then we talk about, well, how are we communicating where patients can get vaccine? How are we communicating about pop-up clinics? And that happens there, and then you get the right people involved, and the word gets out. It's a little hard sometimes being inside these institutions where you're not quite sure if the word's getting out. That's why I love being here to hear everybody else's take on this too.
I noticed one of our faculty leads, Dr. Marsh, you came in at a good time because I have a question about pregnant women and vaccines. That's the next question in the queue. Dr. Marsh is Division Chief for Reproductive Endocrinology at Michigan Medicine. So Erica, the next question in the queue was they want to become pregnant soon. They're concerned about getting the COVID vaccine and it harming the developing fetus. How would you address her concerns? I'm sorry to call you out.
That's okay. That's okay. Hi, everybody. Let me first say hello and thank you to our special guest, and apologize for joining this monthly event that I so look forward to late. I'm coming from Dr. Hackert's country, driving back from Flint, where I was at Hamilton seeing patients today. So I was hoping I could get back in time for the beginning, but I'm just getting back. You know, there's no data to suggest that that any of the vaccines are harmful to developing embryos or fetuses. And in fact, the general recommendation is for folks to go ahead and get vaccinated. And you know, I'm on the getting people pregnant side of OBGYN, not the OB side of OBGYN. So I want to, you know, I certainly want to, you know, put parameters around what I do on a day-to-day basis. But in general, the American College of OBGYN recommendations are for folks to, you know, that you know, it's safe to get the vaccine, and that there's no data at this point to suggest that there's any untoward outcome. And the data that we've gotten actually suggests that there's benefit to being vaccinated, that, you know, in terms of immunity that can get passed on in the setting of pregnancy and delivery. So I know there's a lot of fear, there's a lot of concern, but I'm encouraging my patients to go ahead and get vaccinated, who are undergoing infertility, and feel solid in that recommendation. Dr. Cinti, have you seen, I know you're on the cutting edge of data. I feel like you see results before they're publicly released. Have you seen anything differently? All the ACOG data has been, you know, that there's nothing to suggest that there's anything concerning.
Absolutely, Erica, thanks. You hit it out of the park. I can't add much to that, except to say the Society for Fetal Medicine, for Fetal and Maternal Medicine also came out and said, so two very great organizations who look at science and nothing else when they're making recommendations have said that pregnant women who are at higher risk that they strongly recommend that they get the vaccine, and that they should talk to their OB docs about it, of course, but
yes.
But all those doctors are also on board. So yeah, thanks for that.
I'm trying to think. There's a couple more questions, but I don't know if we'll be able to answer it. But we have a question from one of the attendees about just asking if each of your health departments have phone numbers where people can call to make vaccination appointments rather than going online with tedious forms and hoops, especially with internet connections, and access to computers is not always the norm for some people. So wanted to check in with health officers if you guys have phone numbers that people can call to make appointments. And I'll start. Carol was nodding. Carol?
Yes, we have it's a toll-free number. It's on the Wayne County website, but I can give it out here. 866-610-3885. And
Awesome.
like I said, yeah, you call.
We'll add that to our website too.
Great, thank you. Call, make your appointment, and we are running our clinic. So yeah, it's working out very well. Having that call center where, like you say, people, there are just a lot of people who just say they want to be able to just call and have someone else make the appointment. And the first appointment and then the second appointment is made, the second dose appointment, all at the same time.
Pamela, you guys have a number in Genesee County?
We do, and that was actually our very first community outreach. I think it was probably the second week of January, second week I was here certainly, that we started working with our 15 senior centers in the county, so that the seniors who were in that targeted population at the very, very beginning could call the senior center if they wanted to and not just go on the internet. So the senior centers, we distributed Excel sheets to everyone at the very beginning. It's improved and become more sophisticated as time goes on, but it had one Excel sheet that they would send in at the end of the day, and then we would combine them all and then make our calls back. And we had initially tried putting appointments on the website, but it wasn't just the community calls that were crashing the website. Weirdly enough, there were some very foreign, about a third of our calls were foreign, very far foreign things that crashed it. So we started actually then, in response to that, making phone calls at the beginning. Our numbers of vaccines weren't that great, so we were calling people to offer them spots and schedule them by phone. But also you could go online shortly after that and do it. So we still have that. We have it with the Valley Area Agency on Aging and our senior centers, and then also the health department. We have a call center set up now.
Thank you. Adam, I'm sure you guys have one too.
We do, and that phone number is 833-755-0696. And also for those who are comfortable using the internet, it's vaccinatewest.mi.com. And there are links there for a number of providers and clinics in West Michigan, including the West Michigan Vaccine Clinic, which allows for direct scheduling. So you can go on, you can get an appointment right now. And that's open to anyone. So it's not just Kent County residents. Anyone who's watching this, if they're interested, can use that site to schedule an appointment.
Thank you. I know, Erica, you have a question?
Yes, I do. It may sound like an odd question, but it's a question I have gotten from family members and community members. And I think it's important. A lot of these town halls' goal is to get factual information and correct information out to the community, but also understand some of the concerns that the community members are having. I have to start by saying my 98-year-old grandmother got vaccinated today. And I'm really proud of her because the concern she had, and this is the question, for quite some time, that she and her friends that are much younger than her and her friends that are her age were concerned that the vaccine at some point was going to turn people into zombies, that something transformative was going to happen at some future point in time because of the vaccine. And I hear that actually not infrequently. And so I just wanted to maybe start with Dr. Cinti and then talk to our public health officials to see if you've had any cases of anything transformational happening. But to respectfully, I mean, I think it's a common concern, and I just want to kind of authentically discuss that. Dr. Cinti, is there any data that to suggest that there's some, at some point we're going to all undergo a change from the vaccine?
No, none. Yeah, none at all. We're seeing, there's been some concerns about the Johnson & Johnson vaccine, and I can talk about that separately. But the vaccines we've been mostly using around the state, Moderna and Pfizer, they're new, and that's why people were concerned about them. But I have to say, they're really amazing vaccines, and I think mRNA is going to be the platform for vaccines in the future. And just to go over it quickly, it's a piece of genetic material that holds the message for your body to then make a portion, not the virus, but just a portion that your body then responds to. So I use the analogy, everybody knows Mission Impossible, right? So the Tom Cruise character gets a message from whoever, his boss. The message, what happens after he gets the message? It self-destructs. And then he goes and saves the world. And he's been given the message. And that's what we're getting. We're getting the message. That piece of genetic material never gets into our DNA. It never gets into the nucleus. It gets destroyed almost immediately. And as a matter of fact, it's so delicate that the reason they couldn't figure this out for a long time, they couldn't find anything to hold this little piece of material to keep it safe till it got into the cell to do its work. So it gets into the cell, it does its work, and then it's destroyed by the enzymes in the cell. So no, there's nothing left to cause us to be zombies or to change us or to hurt fetuses in any way.
If anything, Dr. Cinti, I'm hearing that instead of long-term effects, the vaccines, if anything, may not last as long as we want them to, and we may need a booster dose.
Yeah, we talked about boosters.
Is that true? Have you, and you may have talked about that already tonight. If you have, I apologize. But
no, that's okay. No, it's true. I mean, to extend that, we hope it's long lasting, and at least it will probably be at least a year. It may be longer, but we may need boosters in the future. And again, with the same type of vaccine, with the same effect, that it would send the message, get destroyed, and that's it.
Okay, thank you.
Yeah.
Thank you.
So I do have a little, similar analogy, but for those who may not have seen Mission Impossible.
Thank you.
I like the sticky note analogy. So you have like important things, like I'm writing it down right now, but once I get these things done, I tear it up and throw it out, and it's gone. I don't keep it around, it's gone. And it's the same type of thing, but it's the sticky note of vaccines.
I'm using it. Thank you.
So we only have 2 more minutes. I was hoping to have time for everyone. Maybe you guys could each give a closing sentence, but I wanted to personally thank Pamela Hackert, Carol Austerberry, Adam London, and Sandro Cinti for our 4th webinar. It was amazing. I'll just ask, does anybody want to just say one thing that they want to leave our audience with tonight?
Sure. Yeah, real quick. So first of all, thank you, everyone. I have a sneaky suspicion the people who are watching this have done their part and are making it difficult for this virus to spread. But your job is not done. Right now, we need you to bring someone else to get vaccinated. So be influential with those who trust you and try to recruit some other people to get vaccinated. We need your help right now.
Ditto.
Thanks, Adam. Yeah.
I would give a shout out to Yvonne Lewis, who I see is on our list there. This woman is amazing. I have called her literally on a Saturday and said, can you register 200 people for us? And she does. So thank you, Yvonne.
Carol?
Yes, and from Wayne County again, it was an honor and a pleasure to be on this panel with everyone. I too have taken some sticky notes away with me. And yeah, it's when it's your turn, it's everybody's turn. You know, there's no longer the priorities and the eligibility groups. Get vaccinated. I love the idea. Yeah, bring someone else. If you know, so many people I hear say, oh, I'm going to wait for the seniors in my neighborhood. And no, why don't you bring them and then both of you can get vaccinated? So this is the time for us to, you know, just take care of our community. That's what it's all about. Get vaccinated.
Well, thank you again. Just like our Facebook page, Michigan CEAL, you'll see our next series in May, not series, but the 5th installment. We're going to be highlighting faith leaders from each of the counties represented here, plus Washtenaw County. So we'll send you that save the date soon. And if you want to, you know, share this recording with your counties, just share it from Michigan CEAL to your Facebook pages so that others can watch it and learn from it. And everyone have a good night.
Thank you. And thank you, Maria, for translating tonight. We appreciate you, and what you're doing is so incredibly valuable and important for us reaching all of, you know, trying to reach as many people as we certainly can. So thank you, Maria. And thank you to our panelists, of course. And thank you, Tricia, for doing an outstanding job moderating. Good night,
Hard shoes
everybody.
to fill.
Thanks, everybody.
Thank
It's great
you.
to see you all.